Its official name is dracunculiasis. For those stricken, it is a painful experience, particularly when the parasite, also known as guinea worm, emerges from the body. In 1986, more than 3.5 million people in 20 countries were infected with guinea worm. That's when former U.S. President Jimmy Carter and his staff at the Carter Center near Atlanta, Georgia, took on the neglected disease with the goal of complete eradication.
Everybody that reads the Bible knows about guinea worm. If you read about the Hebrews escaping from Egypt, slavery, they were afflicted with the fiery serpent. And the fiery serpent is guinea worm. And if you've ever seen the symbol for doctors, the caduceus, with a staff there with things wrapped around it, those are not snakes, they're guinea worms. So everybody knows about guinea worm, even if you never have heard of dracunculiasis.
The end of guinea worm is in sight, thanks in part to the Carter Center's efforts to show people in remote African villages how to prevent infection by filtering any drinking water that might be contaminated with the parasite larvae. The efforts paid off in Niger and Nigeria. Mr. and Mrs. Carter honored both countries at a recent Carter Center ceremony celebrating their successful eradication of guinea worm. Nigerian Minister of Health Onyebuchi Chukwu considers the milestone a miracle.
What was achieved with the fight against guinea worm in Nigeria is nothing short of a miracle. From carrying half of the global guinea worm burden in 1988, Nigeria today carries none.
Dr. Donald Hopkins, Director of Health Programs at the Carter Center, says with Niger and Nigeria now off the list of countries with guinea worm, the rate of new infections is at an all-time low.
As of the end of 2010, we had for the first time less than 2,000 cases reported globally of guinea worm disease, 1,797 cases to be exact. Most of those cases, about 1,698, were in Southern Sudan.
During Sudan's civil war, much of the country was off limits to health workers trying to reach affected areas. After several years of relative peace, and now independence in the south, the new country remains one of the most challenging battlegrounds in the fight against guinea worm.
That part of the world has a lot of disadvantages in that it's poor. It's a vast area, very little infrastructure, a very long rainy season, and we have to fly supplies everywhere, which is very expensive.
While there are still active cases of the disease, mostly in Southern Sudan, former President Carter says cross-border transmission is a major concern of U.S. and United Nations health agencies.
We've also found a recent outbreak of guinea worm in Chad, which had been completely free of guinea worm and for more than 10 years. But recently we found a few very isolated cases, and now CDC and WHO are in Chad. So we'll be going there to make sure that we can stamp out these re-emerging small cases of guinea worm.
When the new government takes control of Southern Sudan in July, the country will face many challenges. Dr. Hopkins says government officials consider guinea worm eradication a priority.
President of Southern Sudan, Salva Kiir, is very supportive of this effort, and he told President Carter that, again, this past January during the referendum when President Carter was there. So we're hopeful.
But Dr. Hopkins cautions that any renewed violence or insecurity in Sudan could threaten health efforts in the country and could delay the Carter Center's target date for complete eradication of guinea worm, now set for 2012. Kane Farabaugh, VOA News, Chicago, Illinois.
It's just coming like that.